Perform hand hygiene and ensure privacy. To take a blood pressure by the two-step method, first, check the patient's baseline reading and determine the best site to use. For example, if she is receiving intravenous fluids in her left arm, use the right arm to take her blood pressure.
All right, great. I just need to check your armband. Could you please tell me your name and date of birth?
Introduce yourself to the patient, then identify the patient using two identifiers. Then, with the patient supine or sitting, position the forearm at heart level and support it with her palm up. If the patient is sitting, have her keep her feet flat on the floor. Expose her upper arm fully by removing any clothing that's in the way. Also, make sure you have the appropriate size blood pressure cuff for the patient. The cuff's width should be 40% of the circumference of the midpoint of the limb on which it will be used. The cuff's bladder should encircle at least 80% of the upper arm. Now, palpate the patient's brachial artery in the antecubital space. Once you locate it, position the cuff 1 inch above the artery, with the cuff's arrows centered over the artery. If the cuff doesn't have arrows, estimate the center of the bladder and place that over the artery. Then wrap the fully deflated cuff evenly and snugly around the upper arm. Position the manometer vertically at eye level and stand no more than 1 yard away from it. Using the fingertips of your non-dominant hand, palpate the brachial artery distal to the cuff while inflating the cuff with your other hand. Note the point at which the pulse disappears and continue to inflate the cuff 30 mmHg higher. Note that point, then slowly deflate the cuff. Note the point at which the pulse reappears. This is the palpated systolic pressure. The measurement is expressed in millimeters of mercury, commonly referred to as mmHg. Fully deflate the cuff and wait 30 seconds. Next, clean the earpieces, diaphragm, and bell of the stethoscope with an alcohol swab. Place the stethoscope earpieces in your ears, following the angle of the ear canals, and make sure the sounds are clear, not muffled. After relocating the brachial artery, place the stethoscope's bell or diaphragm chest piece over it, but don't let the chest piece touch the cuff or any clothing. Close the valve on the pressure bulb by turning it clockwise until it's tight. Then quickly inflate the cuff, 30 mmHg above the patient's palpated systolic pressure. Slowly release the valve on the pressure bulb and let the manometer indicator fall 2 to 3 mmHg per second. Note the point on the manometer when you hear the first clear sound. This is the first Korotkov sound, which reflects the systolic pressure. The sound will slowly increase in intensity. Continue to deflate the cuff slowly, and when the sound disappears, note the pressure to the nearest 2 mmHg. This is the fifth Korotkov sound, which reflects the diastolic pressure. Listen for 10 to 20 mmHg after the last sound, and then let the remaining air escape quickly.
132/80 is your blood pressure. Do you have any questions? No. All right. Take this out.
For greater accuracy, take the patient's blood pressure again in 2 minutes. Use the second set of measurements as her baseline. Then remove the cuff from the patient's arm. If this is her first assessment, repeat the process on her other arm if possible.
Roll your sleeve down.
To complete the procedure, help the patient into a comfortable position. Replace the clothing on her upper arm and tell her about your findings. Perform hand hygiene and clean the earpieces, diaphragm, and bell of the stethoscope with an alcohol swab. Compare your findings with the classification of blood pressure for adults. Normally, the systolic pressure is less than 120 mmHg, and the diastolic pressure is less than 80. In prehypertension, the systolic pressure is 120 to 139 mmHg, and/or the diastolic pressure is 80 to 89. In stage 1 hypertension, the systolic pressure is 140 to 159 mmHg, and/or the diastolic pressure is 90 to 99. In stage 2 hypertension, the systolic pressure is 160 mmHg or higher, and/or the diastolic pressure is 100 or higher. As part of your follow-up care, compare this blood pressure measurement to the patient's baseline.